Welcome to the deep dive. Our mission is pretty straightforward. We sift through the info, pull out the important stuff for you.
So you don't have to wade through it all.
Exactly. And today, our topic is having a healthy pregnancy. We've looked at a whole range of information, really comprehensive stuff.
Yeah, everything from lifestyle choices, diet, exercise, all that, right through to prenatal care specifics.
And even understanding potential hazards, warning signs, and managing stress, which is a big one.
It really is. Pregnancy brings up so many questions, doesn't it?
Yeah.
And just a flood of information sometimes.
Right. So we're aiming to cut through some of that noise today, clarify the key things for a healthy journey for both you and your baby.
That's the plan, to really dig into those core elements based on the information available. The choices you make, medical care, awareness, stress, it all fits together.
Okay, so let's dive right in. Where do we start? What's the foundation?
Well, the information really points to lifestyle as the bedrock. It's fundamental.
Lifestyle meaning?
Meaning things like eating well, getting appropriate exercise, enough rest. But it's not just about physical health.
Right, the mental well-being aspect too.
Exactly. And crucially, it all directly impacts the baby's development. They're completely interconnected. Nourishing your body, staying active sensibly, resting, it creates the best possible environment.
Yeah, that makes total sense.
Yeah.
Setting the stage. Okay, so beyond that foundation, the next big piece seems to be prenatal care.
Absolutely essential. The information stresses this again and again.
Can you break that down a bit? What does prenatal care actually involve?
Sure. It's basically the ongoing medical supervision during pregnancy, regular checkups with your midwife or doctor.
Just routine checks.
Well, yes, but especially that first visit. It's usually quite detailed, a full physical exam, some initial tests, and a really deep dive into your medical history.
What kind of history?
Oh, everything. Past surgeries, any illnesses you've had,
Right.
family history, hereditary conditions, that sort of thing. Your reproductive history, too. Allergies, medications you're currently taking.
Even mental health.
Yes. Behavioral and mental health history, screening for STIs, any substance use. They even ask about your living situation and screen for domestic violence. It's about getting a complete picture from the get-go.
Wow. Okay, so that sets the baseline. And then there are tests throughout pregnancy. The info-mentioned screening versus diagnostic.
That's a key distinction.
Yeah.
Prenatal tests are looking for potential health problems, either for you or the baby.
So screening tests are...
Think of them as the first pass. Usually quick, easy. They assess your risk for certain conditions. A negative screening test is reassuring, means lower likelihood.
But if it's positive...
It doesn't automatically mean there is a problem. It just means more investigation might be needed, usually with a diagnostic test.
And those are...
Diagnostic tests are more specific. They aim to confirm or rule out a condition flagged by screening, or if there are other risk factors. They're generally more accurate.
But maybe more involved.
Often, yes, they can be more invasive, potentially cost more, and might carry slightly higher risks than screening tests, so they're used more selectively.
Got it. Okay, so if your caregiver suggests a test, what questions should you be asking? The information must have pointers on that.
Definitely. It's really important to feel informed. You should ask things like, how is this test done? What are the benefits? Is it screening or diagnostic?
Yeah, what exactly is it looking for?
Yes, what condition? How reliable is it? How will the results change my care plan? What are the risks to me, to the baby?
What about practical things?
Absolutely. Ask about cost, insurance coverage. Are there alternatives? And what happens if I don't have this test? Getting answers helps you make an informed choice.
That's a really practical checklist. Empowers you, doesn't it? So during those regular prenatal visits, what usually happens? What are the standard checks?
At most visits, they'll check your blood pressure screening for hypertension. They'll track your weight. They'll do an abdominal exam.
Measuring the bump?
Essentially, yeah.
Yeah.
Measuring the fundal height from the pubic bone up, which helps estimate the baby's growth, and of course, listening for the fetal heartbeat with a Doppler.
Always a reassuring sound.
It really is. Then there are other things done at specific times, or for certain people, maybe a cervical exam or Pap test early on. Blood tests are common initially.
For what?
Confirming pregnancy, checking your blood type and Rh factor, screening for infections like hepatitis B or C, checking for anemia, sometimes glucose levels, and ultrasounds, of course.
Oh, yes, ultrasound. Everyone looks forward to those, right? What are the main reasons they're done?
They serve several purposes. Early on, maybe a transvaginal one, to confirm the heartbeat, get a more accurate due date by measuring the baby, check for multiples, rule out an ectopic pregnancy.
Which is when it implants outside the uterus.
Exactly. Then later, often around 20 weeks, there's the big anatomy scan,
Looking at all the bits and pieces.
pretty much. Examining the baby's organs, brain, spine, limbs in detail. Ultrasounds are also used later to check amniotic fluid levels, the placenta's position, and monitor growth if needed.
Okay. And the info also mentioned genetic screening, different types.
Yes, several options might be offered. First trimester screening often combines a blood test with a specific ultrasound measurement, the neutral translucency.
Looking at the back of the baby's neck.
Right. That combo assesses risk for things like Down syndrome trisomy 18. Then there's cell-free fetal DNA testing, or NIPT.
That's a blood test too.
Yes, usually done around 10-13 weeks. It analyzes tiny fragments of the baby's DNA in your blood, screens for common chromosomal conditions, and can often tell you the baby's sex.
And second trimester.
There's often the quad screen, another blood test usually between 50 and 22 weeks. Looks for similar conditions, often used alongside the anatomy scan findings.
And if one of these screenings flags a higher risk, that's when diagnostic tests come in.
Typically, yes. The main diagnostic tests mentioned are amniocentesis, chorionic villus sampling CVS, and sometimes fetal blood sampling.
How do those work?
Amnio involves taking a small sample of amniotic fluid with a needle, usually after 15 weeks. CVS takes a tiny sample of placental tissue, usually earlier, between 10 and 13 weeks. Fetal blood sampling takes blood from the umbilical cord, usually after 18 weeks.
And these are the ones with higher risks.
They are considered invasive and do carry small risks: miscarriage, infection, bleeding. That's why they're generally reserved for situations where screening indicates a higher risk or there are other specific concerns. It's a discussion to have with your provider.
Definitely careful decision. Okay, shifting slightly. Monitoring the baby's movements later in pregnancy. Why is that important?
It's presented as a way for you to get familiar with your baby's own unique activity pattern. A healthy baby usually moves consistently.
So you notice if something changes.
Exactly. If there's a significant decrease in movement from what's normal for your baby, it could be a sign they aren't doing as well. The info mentions the count to 10 method.
How does that work?
You basically time how long it takes to feel 10 distinct movements, kicks, flutters, whatever, during a time your baby is usually active. The key is noticing a slowdown or change from their usual pattern. If you do, contact your caregiver.
Good practical advice. Are there other formal tests for checking the baby's well-being late in pregnancy?
Yes, especially if there are risk factors. There's the non-stress test, or NST. It monitors the baby's heart rate pattern, looking for accelerations with movement.
Okay.
Then the biophysical profile, or BPP. That combines an NST with an ultrasound to look at heart rate, breathing movements, body movements, muscle tone, and amniotic fluid volume.
So more comprehensive.
Yes. And sometimes a contraction stress test, or CST, is used. It involves monitoring the baby's heart rate during contractions, either spontaneous or induced, to see how they cope. These tests help providers assess the baby's condition.
Right, lots of tools available. Okay, so we've covered care, but what about when things might be going wrong? The information stresses knowing warning signs.
Critically important. Catching complications early makes a huge difference. You need to know what warrants an immediate call to your doctor or midwife.
What kind of signs are we talking about?
Things like any vaginal bleeding, any significant abdominal pain, cramping, constant ache, sudden severe pain, leaking fluid, or a sudden gush.
Swelling.
Yes, sudden or severe swelling, especially face or hands, or rapid weight gain. A severe headache that won't go away, particularly with vision changes like blurriness or spots.
Anything else?
Persistent dizziness, a new cough, wheezing, shortness of breath, or chest pain. Definitely a decrease in your baby's movements from their norm after about 28 weeks.
What about pain elsewhere?
Pain, swelling, or redness in one leg could be a clot. Severe pelvic or a hip pain making it hard to walk. Painful urination, unusual vaginal discharge, itching or sores, a fever.
Even nausea. I thought that was normal.
Persistent nausea or vomiting where you can't keep anything down needs checking. And crucially, feelings of severe depression, overwhelming anxiety, or thoughts of haunting yourself or the baby, any of these need immediate attention.
That's a vital list to be aware of. Don't hesitate to call, right?
Absolutely.
Better
Well-
safe than sorry.
Now, another big topic, stress. Pregnancy is stressful. How does that impact things?
It really can. The info distinguishes between normal short-term stress and chronic ongoing stress. That chronic stress is the bigger concern.
Why is that?
Well, prolonged stress keeps stress hormones elevated, which can potentially affect blood flow to the placenta, maybe impacting nutrient and oxygen delivery to the baby.
Oh, wow. Any other links?
It's been linked to increased risk of high blood pressure in pregnancy, maybe preterm labor, or lower birth weight. Some studies even suggest potential long-term effects on the child's development later on.
So managing stress is pretty key then. What helps? What does the info suggest?
Lots of practical things. First, just recognizing your stress response. How does it feel in your body? Then, identifying the sources. Can any be reduced or eliminated?
Asking for help.
Definitely. Partner, family, friends, delegate. Prioritize self-care. Rest, relaxation techniques like deep breathing or mindfulness, activities you enjoy. The basics too, like diet.
Yes, eating well, staying hydrated, gentle exercise as advised, spending time outside, practicing gratitude, talking about worries, all can help. Connecting with a baby, just placing hands on your belly can be calming too.
And if it feels like too much,
Seek professional help. If stress is overwhelming, causing constant anxiety, depression, messing with sleep or eating, talk to your healthcare provider or a therapist. Don't tough it out alone.
really important advice. Okay, what about common discomforts? Headaches, colds. How do you handle those safely?
The general advice is to try home remedies first. For headaches, warm bath, massage, gentle stretches, hot-cold packs. Check if you're hungry, dehydrated, or tired.
Colds.
Rest, humidifier, steam, plenty of fluids, maybe honey and lemon, saline nose drops. The usual stuff.
Oh.
Back pain, good posture, careful lifting, gentle exercises, rest, heat, cold,
Sleeplessness.
gentle exercise during the day, warm bath or milk before bed,
Yeah.
calming music, reading, relaxation techniques, and try to avoid screens right before sleep.
But what about medication if home remedies aren't enough?
This is crucial. Always check with your caregiver before taking any medication, over-the-counter or prescription, and tell all your healthcare providers you're pregnant.
Good point. What should you ask about a medication if it is suggested?
Key questions. What dose? How often? Max dose? Any interactions? How long should I take it? Is the timing in pregnancy important?
Are there common OTC meds to avoid?
The information mentions some should be avoided or limited, yes. And it definitely highlights that certain medications, known as teratogens, are known to be harmful and cause birth defects. Always check first.
Okay, that leads us into avoiding harmful substances and hazards generally. Sounds like a big category.
It is, and it's vital. The basic message is, almost everything you're exposed to can potentially reach the baby.
That sounds scary.
Well, the advice is to use the information to reduce exposure, but not to become overly anxious. The effect often depends on the dose, how often you're exposed, and importantly, when in pregnancy. First trimester is often most vulnerable.
What are the big ones to be cautious about?
Alcohol is a major one. The info states no safe amount has been determined. Risks like fetal alcohol syndrome are serious, especially with first trimester exposure. Best to avoid it completely.
Tobacco. Nicotine.
Absolutely avoid. Smoking, vaping, chewing tobacco all expose the baby to toxins linked to miscarriage, stillbirth, birth defects, low birth weight, preterm birth, SIDs. The list is long. Quitting is crucial, and avoid secondhand and even third-hand smoke.
What about cannabis?
Research is a bit mixed, but potential risks are flagged: preterm birth, low birth weight, possible effects on brain development. Caution is advised.
Illegal drugs. Prescription drug misuse.
Very dangerous. Drugs cross the placenta easily, linked to severe harm, preterm birth, stillbirth, and neonatal abstinence syndrome where the baby goes through withdrawal. Avoid all illicit drugs and get help if you're struggling with substance use.
Beyond recreational substances, what about things in food or the environment?
Yeah, caffeine limit intake. Herbal teas and supplements safety is often uncertain. Some can have hormonal effects or interact with meds, so be cautious. Mercury in fish and foodborne bacteria are risks too, usually covered in dietary advice.
Environmental hazards.
Things like abuse or domestic violence, sadly, the risk can increase during pregnancy. Seek help, there are resources. Herbicides, pesticides, minimize exposure. Occupational hazards, talk to your employer. Use protective gear if needed. Chemicals, radiation, etc.
Even hobbies or
Right.
home stuff.
Chemicals from hobbies, yeah. House paint, choose low or no VOC. Ventilate well. Hair treatments, generally low risk, but minimize exposure, ensure ventilation. Avoid overheating from saunas, hot tubs, especially early on. Electric blankets, use cautiously. Radiation like x-rays, always tell providers you're pregnant. Wireless devices, EMF risk is unclear, but practice safe usage.
Wow, okay. It's a lot to be mindful of. It really sounds like being informed is the key.
It is. Awareness allows you to make choices to reduce risks where you can.
Now, something really important the information covers is the partner's role. How can partners best support a healthy pregnancy?
Oh, hugely important. The partner's support, compassion, encouragement it makes a massive difference to the pregnant person's well-being.
In practical ways.
Absolutely. Partners can support a healthy lifestyle by making changes themselves, maybe eating healthier together, exercising. If their job involves hazards, using protective gear and reducing bringing those hazards home.
What about direct involvement in the pregnancy?
Yes. Attend prenatal appointments when possible. Ask questions about tests and results too. Learn the warning signs we talked about so they can help recognize them.
Helping with discomforts.
Big one. Helping with chores, offering massages, assisting with comfort measures for back pain or nausea. Reviewing those stress coping skills together. Maybe even considering counseling if the pregnancy is putting strain on the relationship.
And the partner's own substance use.
Crucial. If the partner controls their own use of alcohol, tobacco, or drugs, it hugely supports the pregnant person's efforts to avoid them too. It's a team effort.
The info even mentions partner health before conception.
Briefly, yeah. Some hazards can affect male reproductive health, so partners planning conception can also benefit from limiting their exposure to things like toxins. It's all connected.
That's great context. Okay, one last area the information touches on. Travel during pregnancy. Any key pointers?
Generally, the second trimester is often considered the sweet spot for travel, when energy levels might be higher and risks lower. But always consult your caregiver first for advice specific to your pregnancy.
Are there restrictions?
Airlines and cruise lines might have restrictions later in pregnancy, so check policies.
No.
Avoid flying at high altitudes in unpressurized planes.
International travel.
Check for health warnings or vaccination recommendations for your destination. Make sure your health insurance covers potential hospitalizations abroad.
What about the journey itself? Long trips?
Yeah, long periods of sitting increase the risk of swelling and blood clots. So get up, walk around, stretch regularly on planes or during car rides. Wear your seatbelt correctly, lap belt under the belly, shoulder strap between the breasts.
And discomforts might flare up.
They might. Nausea, fatigue, back pain can feel worse when traveling. Plan accordingly, pack remedies, take breaks.
Good tips. Well, this has been incredibly thorough. It feels like we've really unpacked the key elements.
Yeah, from lifestyle and prenatal care to being aware of warning signs, managing stress, avoiding hazards, and the partner's vital role.
It really highlights that pregnancy is an opportunity, isn't it? To focus on health, make positive choices.
Absolutely. And being informed about all these aspects, lifestyle, potential risks, the care available, empowers you to make the best decisions for yourself and your baby.
Asking questions, being an active participant in your care, it seems essential.
It really is. It's your journey, and having this knowledge gives you agency in creating a healthy pregnancy and a great start for your baby. That process of learning and making informed choices is powerful in itself.
A perfect thought to end on. We hope this deep dive has provided some valuable clarity on navigating a healthy pregnancy. Thanks so much for joining us.